Hi, I am Paige Sims. I am the owner of Restore Physical Therapy in Edmond, Oklahoma. I primarily treat women that have gone through breast cancer, and I would like to just talk today about the importance of physical therapy, especially exercise, with people that have gone through breast cancer and the reasons that it's so helpful and what I've seen in my practice. The first thing I think is really important is seeing physical activity as a new vital sign. You know, when you go into a doctor's office, we would never not have our blood pressure taken, our heart rate, our height, and our weight. But a new vital sign that is starting to be recognized is physical activity. And I think as a physician, a lot of times that may be something that would just strike, a conversation. If you see it as a vital sign, oh yeah, another vital sign is how are you doing with physical activity? How are you doing with your function? That way, that portion of their care doesn't get missed. A lot of things I'm seeing in the clinic is I specifically see women, but they are just saying that, the doctor just didn't really ask me how I was doing physically. And it didn't, I had to ask, can I go to physical therapy? Or I had to say, I'm not doing well. And, my shoulders really hurting when I'm lifting overhead, or I can't do the things I used to do. And then that promoted the conversation that, oh, well, have we not sent you to physical therapy? And I think that the biggest thing I love to see becoming more global and more standard of care is that that referral gets sent more proactively and quicker than, after the fact that the patient is having difficulty with scar pain, or they're having a lot of hypersensitivity and nerve pain because of their scarring from surgery, or they're having trouble with movement, those kind of things. And then the conversation's coming up. So that is one of the big key points that I would love is if a physician would just start to think of that as a vital sign. I think that would be huge, and it would help so many of the women out there that are being overlooked and that aren't getting physical therapy and are even a couple years out and wondering, oh, I guess this is how my normal is always going to be now, or I guess this is just how it's supposed to be. And I want to scream from the top of my lungs, no, this is not how it's supposed to be, and this isn't how it needs to be. There is help out there. There's a lot of help. I would say every single patient that's walked through my door, 100% of them are so glad they came, so glad their doctor referred them, wish they'd come sooner, are so glad their breast cancer support group told them about us, told them there's specialized physical therapy care for this. They're a different person when they leave at discharge. They come in, you can see that they feel really defeated. They feel like they can't move, their energy level's low. There's like very certain things they feel like it hurts when they lift their purse that's heavy, or it hurts when they're putting on their seatbelt, or when they're trying to lower the SUV, the back of the SUV. I mean, or they're feeling lymphedema, heaviness and achiness in their arm when they're lifting their child, these specific things. And then by the time discharge, they're just saying 100%, I'll say 0 to 100% better since you started physical therapy. And they're like 90% better. And it's so rewarding. But as a physician, also, you want to see your patient feeling that much better. And if you can give them that gift, it's such a great thing, because you have that right there in your pocket. All you have to do is you ask that question as the vital sign, and they say, yeah, they're having trouble with physical activity. And that triggers the referral response to physical therapy. And it's that easy, because then you get that referral sent over and your patient's getting the care that they need. And then they're so happy. Their journey is continuing, and it's continuing their response in a good way. And I think that also the other part for a physician, I think, is important to know is then as a physical therapist, we get to be the eyes for you. We get to be the eyes on that patient once or twice a week, or how many ever times they're coming in. And as a physician, your schedule is way too busy to be seeing someone that often. You're seeing them maybe 3 months post-op, and then maybe 6 months down the road. And so if you have a good relationship with the physical therapist that you're referring to, I know for me, I text my physicians, and if something is not looking right, if something, a lot of times it'll be a scar tissue and it'll be red, or I'll feel like there's a question, I'll just take a picture really quick and send it over. And then that way, if the office thinks, yeah, we need to get them in, just, they'll call right away. And I think as a physician, that's really nice to feel like we get to be another set of eyes for you. And then the patient feels really secure, like, oh, you're going to text it to my doctor today. And I'll text and say, okay, the doctor says it's just fine. Let's just keep watching it. And so they just feel like there's this really nice team taking care of them. So I think that's another really great benefit to having a physical therapist working with your patient. So, one, I just wanted to say it's a vital sign. If that can just click in your head, like ask about their physical activity. If they're not doing well, just that triggers that referral. Second would be use it as a form of cancer treatment. If your patient comes in complaining that they just feel depressed, or they're struggling with nausea, or they're struggling with fatigue, or they're having trouble feeling like they're back to their normal endurance or stamina, then this physical therapy is a great way and a great form of treatment for those things. Giving another medication or thinking of something in those terms, you could refer to physical therapy, because research shows that physical therapy does help with all of those things. It gives maximal benefit with specifically anxiety, depression, sleep problems, helps with bone density. It helps with mental health, confidence, and functional activity. So, really, those things I see constantly with all the patients I work with. They're mostly dealing with all of those things. So, when they're coming in, again, they leave and I see such a change in their confidence and a huge change in their functional activity and their endurance and stamina. They're telling me that they can go the whole day, go grocery shopping, get their kids to their activities, and it's not just wiping them out at the end of the day. So, I would think that that's another form of maybe it being triggered in your mind as a physician. Oh, it's so easy in that appointment, I'm sure, with your patient in your busy day to think, okay, have we talked about other medications? Have we talked about their nausea? Have we talked about their constipation, or, the millions of things if you've had to look at their blood work that day? But there is such an importance of also checking their physical activity, because they're the ones that are living with pain, and maybe they're not talking about the pain they're having around their scar still because it doesn't get brought up in the appointment, and then they go home later and they're like, oh, I forgot to talk about that. So I just wanted to really talk about the importance of physical therapy helping with all of these things, because it's what I do, it's what I'm passionate about. I see every day how much it helps. It really, I can't overstate the way that my patients say that they are just so thankful they came. And so I think that's the biggest take home message that I wanted to say is, there's so much that we can get I get specifically each woman in a gown, and I get to work at least 30 minutes on scar tissue. So if they've had a deep flap surgery, I get to work on their abdominal incision, both, breast scars, and I just feel like it's care that they're not going to receive if they're not coming in. Sometimes they're so scared to touch their own scars, they'll say they haven't even touched them. So a lot of times we're just breaking through a lot of fear and anxiety they have, that if they're at home and they're not being told how to do something, then they're just not going to do it. And so when they're coming to a professional and they're coming into the clinic, they are getting told how to massage their breast, how to not let the breast tissue get hard, how to not be fearful to touch their scar, how to move and exercise safely. Because if they're not being told, then a lot of times they're just not moving. And then you start getting all these patients with a frozen shoulder because they just didn't know that they should be moving, or they were scared that there was pain and so they didn't move. And so we don't want all these extra issues that could have been avoided if they would have just come early. And I say too, there's no reason not to send people. If they're doing great, then they're going to do great, and they're going to, not come anymore. I think you're not adding to their list. They're going to come if it's helping them, and they're going to be grateful for that. And the other benefit is most major insurances cover physical therapy. So their insurance is already like giving them 25 physical therapy visits in a calendar year, and they're sitting there to be used to help the patient feel better. And so that's how my patients usually see it, is they're so thankful they can use those visits and be proactive to help themselves. So I would say the biggest help for any physician that's looking to, where's a good physical therapist that does this specific kind of care for a breast cancer survivor, is I did my training through, it's called PORI, Physiological Oncology Rehab Institute. So if you want to go to their website, it's PORI.org. So that's pori.org. And then they're going to have a section called More. And if you'll click on More, then under that, it's going to have a therapist directory. And under the therapist directory, you can just put whatever state you're in, and you can find a therapist near you that is specialized. They're going to have specialized therapists in breast cancer. They're going to have head and neck cancers, pelvic cancers. So if you are looking for a specific therapist that does specific type of cancer, you can find them there. If you ever had any questions for me, you can go to my website, www.restorept, as in restorephysicaltherapy.me, and I would be happy to help any way I can or get any information to you. So I love, love, love talking about these things. So reach out to me if you need anything. Thank you so much.